Hello parents, I Leena Raut welcome you all on GenX parenting. As soon as a child is born, we get going with the pediatrician visits because we have to ensure the right nutrition, the right protection for the children. All this is to ensure that we do not compromise on his or her growth. But have you ever thought that if one has to ensure right nutrition or if one has to ensure immunity in child, it is important that we take care of the dental care too. But usually we get conscious about the dental care when we see dental caries, tooth decay or crooked teeth. Sometimes it is really too late. We have already made a vlog on embracing braces for children who have crooked teeth. You must be seeing the link flashing above, so do click on it. But in this video, we are going to talk about must-know pediatric dental care tips. And to talk about it, we have an expert pedodontist, Dr. Nikita Dodeja from Kids Dental Town, Thane West. Hello Dr. Nikita, welcome to GenX Parenting.
Thank you, Leena, for initiating this much needed discussion.
So, Dr. Nikita, what according to you is the right age for the first dentist visit, and why this preventive approach even for dental care is necessary?
The right age to visit a pediatric dentist is before the first birthday or within 6 months of the first tooth coming in the mouth. So when the parents come to us at this early age, we can teach them how to take care of the teeth at night when they are breastfeeding. We can also teach them which toothbrush to use, how to use it, which toothpaste to use at that particular age. So the child does not get cavities in the first place.
What are the key aspects that breastfeeding moms should take care of from the dental care perspective?
So breastfeeding is very important for jaw growth and development too. However, due care should be taken while breastfeeding, that we are keeping the mouth clean. Now, brushing should start from the time the first tooth erupts, that is around 6 months of age. So even if you're going to breastfeed through the night, the child should be brushing post dinner, and then you can breastfeed through the night. When you're breastfeeding after each feed, especially during nap time or during the sleep hours at night, you should clean the child's mouth with a soft cloth, that is a clean handkerchief or soft malmal cloths can be kept. You can keep this next to your bed with a bottle of drinking water. Just wet the cloth, put it around the finger and wipe the child's gums and teeth after every feed. This will help keep the child's teeth clean. So one very important thing is there is this concept कि breastfeeding से caries हो जाता है, cavity हो जाता है, ठीक है? Research shows कि after 1 year if you do breastfeed, there are higher chances of cavities coming up. But I personally feel there are many other factors also. Like a lot of parents will expose their children to processed food very early on. You will see small children with biscuits, with chips, in their mouth, and that is not good for them. Okay, so anything which is processed, like biscuits, chips, juices, then you have cakes, anything that you're literally removing from a packet or a jar, or things that you add sugar to, even good and honey, being healthy can cause cavities. So you need to limit this food in a young child. You should not give a child below 2 years a lot of this food. So it's not just breastfeeding that's responsible, it is the other habits that go along with it also. Another thing is many children start bottle feeding, and this continues till a very long time. So a child can start drinking water from a small glass by the age of 1 year. So the child can start having milk also from a glass from a very early age on. So try not to leave the child with a bottle for very long. Try switching to a glass as early as you possibly can. So milk, plain milk without sugar, without any other added things, should be had from a glass directly as early as possible. As you are breastfeeding or bottle feeding and taking this due care, you should still check your child's teeth for white spots, for yellow discolorations, for some brown spots. If you feel there are any color changes, do visit a dentist and get your child checked at the earliest.
Doctor, in some cases it is observed that a new tooth grows even before the milk tooth has fallen. What should be the plan of action that parents should approach for?
So if you see the milk tooth and the new tooth is coming either from the front or the back and this milk tooth is not fallen, then you have to visit a dentist and get the milk tooth out so that the new tooth can get adequate space and come in more better position.
Now let's talk about something very common in case of children, that's falls. So in case of a fall, if the child faces any kind of a dental injury, what are the points that parents should take note of before visiting the dentist?
So this is a very good question, and I often find that a lot of parents are not aware about what all they can do to help their child. So the first thing is, if your child shows any sign of sleepiness, fainting, giddiness, bleeding from other areas, the child is chakkar aa raha hai, not responsive, not crying, then you first visit a pediatrician even if the teeth are good. If there is bleeding around the mouth and there is no other problem that you are seeing, then you can apply a clean handkerchief or a soft cloth and hold it with gentle pressure on the bleeding side for 5 minutes. Please watch the clock when you do this. You might not be able to gauge time appropriately in this stress situation. Another thing is, do visit a dentist after the fall. So they will check for any teeth which are moving, any teeth which are broken, any gums which have small bruises while the child might be having pain. They might ask you for some x-rays and they will just do a complete evaluation to make sure that the child is doing okay and no emergency care is needed. So there might be a situation where the child falls and the teeth break. Now this could be a milk tooth or the permanent tooth. If a part of tooth has broken, do collect that part, put it in a put it in a little water, and you could take that to your dentist. The dentist might be able to fix that very part back into the child's mouth, and that will give good shape, good color and good aesthetics. Now there might be a situation where the whole tooth comes out. This can be a milk tooth or it could be the permanent tooth. If it is the milk tooth, do not put it back. Okay? Never put a milk tooth back in its place, as while doing so you might hurt the permanent tooth. If it is the permanent tooth, you can put it back. Always hold the tooth by the crown. Crown is the part that you see in the mouth. You just hold it. Wash the tooth with water. Do not try to scrub it. Just put water, drinking water for like 10-15 seconds till there are no visible debris or dirt on the tooth, and you put the tooth back. A good reference point is the tooth next to it. So you can see the surface on the front, the surface at the back, and just place accordingly, and ask the child to bite on a clean cloth or a handkerchief in that position and take your child to a dentist. This permanent tooth can be saved many a times, and it might last your child a few years if you get your child timely help. Now while getting this tooth to the doctor, you need to store it in a medium wherein it will be wet. Never dry the tooth, never get it in a paper or a handkerchief. You can use water, just put it in a glass of water. Milk is an excellent product, cold milk. If you get cold milk easily, if you are around a medical shop, you can buy saline. So these things can be used to store the tooth till you reach the dentist. This will keep the cells alive, and hence we will get good results.
Any tips that you would recommend to parents to inculcate good brushing habits in children, and also what is the appropriate technique to brush?
Brushing should start from the time the first tooth is seen in the mouth. You should use the right size of a toothpaste and a normal bristle toothbrush. From 0 to 3 years, right size of toothpaste should be used. 3 to 6 we can use pea size. 6 onwards you could use 1 centimeter of toothpaste. Now a lot of times the children don't like brushing. So in this situation, I always tell the parent you should brush with the child. Don't just ask the child to go brush. So even at night, stand with your child. It's good to lead by example. You can give them little stars or small rewards to encourage brushing. So till 6 years, a child should be brushing with parental supervision. After 6 years, the child can brush by themselves. Right now, I'll show a technique for children below 6 years. The first is they can make circles. The circle is big enough to cover both the jaws. So they make circles and brush the front teeth. They brush the side teeth. Then they brush the other side. They are taught to brush the chewing surfaces, either front and back or circles if they can. And they brush the lower front teeth in an up and down motion. The same thing is repeated for the upper teeth, wherein they brush the chewing surfaces and the front surfaces like that. Then they are supposed to brush the insides also, which is like this, or in a front and back motion, whatever is easy for the child. So if a child above 6 years is brushing or a parent is brushing for the child, you could use this second technique wherein the circles are smaller, 3 teeth are in one circle. This action is repeated like 10 times and then you swipe down when you are doing the upper teeth. When we are doing the lower teeth, we will do the circular action and swipe up. Now this is repeated for all the teeth on the outside. Then the inner surfaces, the chewing surfaces, we will try to do rounds. If anyway you can't do rounds, do the front and back. The inside surfaces, again circular motions and swipe up, circular motions and swipe, circular motions and swipe. For the upper teeth, you can do circular motions and swipe down. You can do circular motions and swipe down for the insides. And for the chewing surfaces, if you can do circles, that's wonderful. If not, you can do front and back motions. Just one more point, whenever you are performing the circles, for the upper teeth, place the toothbrush at a 45-degree angle facing the gums, and for the lower teeth, again at a 45-degree angle facing the gums.
Doctor, lastly, any best practices that you would recommend to parents to ensure good oral hygiene or dental care?
So there are 5 tips that every child should follow to have a cavity-free mouth. The first is brush twice daily. The second is rinse after every meal. The third is don't hold food, pouch food for very long. No TV, no mobile, no iPad, no books, no toys while eating. Only eat food while eating, no distractions. The fourth point is do not have a lot of junk food or processed food, less of sugars in the diet. And the last is floss at least once a day.
Thank you so much, Dr. Nikita. We hope you found these tips very helpful. So do like and share it with your fellow parents. For more such informative videos, don't forget to subscribe to GenX. Thank you so much.